on, and we're going to have an opportunity to talk about some of the extra services John was talking about we have in this county. And we do have an organization, Visiting Nurses Association, is it?
Visiting Nursing Association of Western New York.
This is Cindy, incidentally, and this is Barb Lauder, Cindy Alstrom. You may know her hubby. Not that we're going to mention him again.
No, don't. We won't even mention his name.
Good guy. He did a nice show here.
Thank you.
Very, very loquacious.
I hope I can do as well.
Oh, you'll do just as well. They are people who, well, I'll let you discuss your services, Cindy. What do you do? What do visiting nurses do? What's the association for?
Well, basically we provide home care. And we have a variety of services. We're a full-service home care agency, and our agency is the Visiting Nursing Association of Western New York. And we really service all 8 counties in Western New York in one way or another. We do have certified services and branches in 5 of the 8 counties. We're present in Erie County, Niagara, Genesee, Allegheny County, and of course here in Chautauqua County. And I'm the branch manager for the visiting nurses in Chautauqua County, and really the purpose of us being here is to share with the residents of Chautauqua County what the different services are that are available. And we were going to target the seniors, and really our services are targeted towards patients that are homebound and that
Which would include a lot of seniors.
A lot of seniors. But not all seniors. We care for patients of all ages. We take care of babies that are 1 or 2 years old, or excuse me, 1 or 2 days old, all the way up to seniors. We have patients that are over 100 years old. So we do take care of patients across the of all ages.
Okay. And Barb, you're here to you're kind of the state section. Now, I assume every state has broken up into different sections, right?
Right, there certainly certified agencies are overseen by New York State in terms of the health department, but our agency really functions within Western New York. That is our primary focus. My role is really specifically to look at disease management with diabetes, with wounds, and also with telehealth and heart failure primarily, because those tend to be some of the highest most prevalent diseases and conditions that are also very costly to seniors.
It's what?
Well. Telehealth is what we call it.
Teleheart or health?
Telehealth.
Health, okay. And so how's telehealth? Will you pick up the phone and say, hey, how you feeling? You know, put the phone against your heart. What's here?
You know, actually when someone does use the term telehealth, it really can mean different things, and I guess I would caution seniors, because across the country you will hear people talk about telehealth, but it really means different things, and you have to ask what that service is. Our particular telehealth, I think technology has dramatically changed what we can do in home care, and more patients aren't treated in the hospitals. They're really being treated at home because the technology allows it to be done so that people can be more comfortable. They're less at risk to get infections by being within their own home, and that's where their comfort is. So telehealth allows us to be able to gather data that can be shared with a physician to better let the patient manage their disease. So we do gather blood pressures, we do gather oxygenation of patients, we do gather weight information, and a series of questions that is asked the patient at home. And then when they push the various buttons, the data goes over your phone line and goes to a central station where the nurses look at that information. And then if there are problems, it will alert to that nurse who can share it with the physician.
Okay, there you go. Now, who pays for this?
Currently,
sick, I call you.
There is no cost. There is no cost to the patient. What happens is it is ordered by the physician. The patient can't speak to their physician about this. If a patient is in the hospital, they can speak with their discharge planner and speak with the physician there about having telehealth in their home, and the patient will not have to pay anything for it. Some insurance carriers cover that and participate. The VNA has also made a decision that part of our care is providing telehealth because we found it has helped reduce the patient's rehospitalization.
Well, it's kind of expensive to have an RN visit your house, so.
Could we talk a little bit about that?
Sure.
Well, the Visiting Nurses of Western New York is a not-for-profit organization, and we accept it when we provide services in home for patients. It is covered by most insurances. Medicare, traditional Medicare, totally covers home care services as long as there's a skill. We do not provide custodial services under this service that is covered by insurances.
Custodial service?
Custodial would be meaning sending in a nurse to give somebody a bath or fix their meals or something like that.
You won't do the hair?
We
You don't do windows?
well, sometimes we do hair and that sort of stuff, but that's not what the insurances and the doctors want us to be doing.
Right.
We,
You're basically a medical care center.
it has to be a skill.
Yeah.
We send in nurses, therapists, and we provide a skill to patients. Now, these services that we provide are for patients that can't get out of their home to access health care. So we have, for instance, we have a very strong rehab department. We have physical therapists, occupational therapists, speech therapists. Any service that you could get in the hospital, we can provide for you in the home. Unless, of course, it's a critical intensive care sort of. You do have to have appropriate condition for us to take care of you in the home. But basically, these services are covered by Medicare. Other insurances, such as Encompass 65, Senior Blue, they're also covered for home care as long as the doctor orders a service, as long as it's a skilled need, as long as it's short-term and intermittent. We can't go into somebody's home and provide services for 2 or 3 years straight.
And not every day, you're saying?
Not every day. It's short-term intermittent. We stabilize the patient. We teach them about their disease process. We help them so that they get to their maximum functioning level, and then we move out.
Give them their insulin shot?
We can give insulin shots. We do a lot with diabetes teaching, and this is Barb's area of disease management. She coordinates the program. We have many, many patients that have diabetes. As you know, in the United States, that is there's an extremely high number of patients in the United States that have diabetes. And we do. That's the sort of thing that we do. We go into the home. We teach patients regarding their disease process. We help them control it. We teach them about their medications, and we do this all in conjunction with the physician. The patient is very active in their plan of care, and so is the physician.
Now, we have programs to take care of patients at their home on the county level as well. Hospice, for instance, and somebody who is trapped at home and their spouse is desperately trying to take care of them 24/7, which is incredible. They wound up in the hospital usually. So they come in and assist. Now, you're not part of that. How do you fit into that sort of a program? You're different from it, but you do overlap, right?
Right. We are not the same as hospice. Hospice is a different home care program. It's normally for terminally ill or seriously ill patients. Sometimes they're at the end of their life. Many times they are. You'd have to have,
I love the hospice says the same thing. Well, we once in a while have somebody survive the 6 months, but let's face it, you're on your way out usually.
It's usually at the end of their life, yes. And we're different. We do have terminally ill patients that we care for. It's the patient's decision and the physician's decision whether they want to stay with the visiting nurses or whether they want to go to hospice. And we work very closely in conjunction with other agencies.
And hospice, I've had hospice on regularly, and I have to laugh, but and they do a good job. But I asked the guy I had on, I won't mention his name, he said, well, we do what the patient wants us to do. Okay, I say, off me. I've had it. I want to die. I do not want the pain and the suffering. Off me. So we wouldn't do that.
I think
now, if I called you over and said, look, take me out, please.
Well, we wouldn't do that either. So, there are some limitations for home care and for hospice, and that would be one of them.
I've got to go to Oregon, right?
What our goal is to keep patients in their home for as long as they can stay in their home safely. And by having an organization such as the Visiting Nurses of Western New York, we're able to keep people out of the hospital. Our rehospitalization rate is extremely low compared to the national benchmark, and our emergent care percentage rate also is very low. And that is very much because of our telehealth program.
Telehealth. Now, what do you do? Hook this up to your telephone? Probably, huh?
It does, if you have a phone line, just
Yeah.
a traditional landline, but a lot of seniors are also getting cell phones, and people are getting rid of their landlines. So we do have cellular units that we can go, and there's no charge for that.
So it's not
being-
electronic, it goes by sound. It's a sonar system.
Well, it would go over it would go through satellites and the cell
Yeah.
towers, yes, the cell towers.
So,
And-
I just wanted to ask you now, you could send this anywhere, right?
You could sit anywhere. I could be in Hawaii, and I could see the data from somebody in Chautauqua. It is web-based, so that it is on the computer, but it is secure so that nobody can get into that
That's
site.
great.
So
I love
can-
the thought of lying on the beach in Hawaii. Bring me another one of those things with another umbrella. I got a phone call here.
That would be ideal.
Okay, we're talking with Cindy Alstrom and Barb Lauder. They're people in charge of the home nursing, or the, what is it, Visiting Nursing Association?
Visiting Nursing Association of Western New York.
Of Western New York, and they are out there to help you if you need it. I mean, if you can't get out of your house for medical needs, they'll come to your house, and it's pretty much paid for by insurance, Medicaid, Medicare. I'm sure everybody pays something toward it. And they can do anything you want for you, just about.
That's right.
Which we've established.
Now
Well, I want to first of all introduce we're going to have a demonstration here. Cindy.
That's right.
We're going to have a demonstration. They're going to show you how the telehealth works, and we've got a victim coming out in a little while. That's what we call them when we do an ambulance. Okay, we still have a phone call. Let's do the phone calls. We got a couple of phone calls.
All right.
Good morning, caller. Thank you for waiting. Hello.
Good morning, Reed. How are you?
I'm fine. What's up, madam?
My question is regarding the specific services they provide. I was wondering, do they come in and like change the gauze on a patient and?
Do they do diapers, right? You're on.
I think what you're talking about is wound care. And yes, that is a skilled service, and that is a part of a service that our nurses would do, and also our physical therapists. We have a very strong rehab team that also have special training in wound care and other treatment modalities, something that's called high volt E-stim, which helps the wounds heal. So yes, this is something that we do. We have a tremendously large number of patients that have wounds that need dressing changes, and yes, that's very appropriate, and we have many patients that we come into the home to care for and change the gauze or the dressing.
That's not it. Okay. Somewhere here I had it. Just let me check. There it is.
She got it, notes. All right, are you still there, man?
All right,
Yeah.
here we have it.
Okay.
We got today down to the Lakeside Park for your thing you were talking about earlier, the Ice
Oh, yeah.
Ice Festival.
Yeah.
At noon, we have a polar bear swim, and 6 p.m. they're going to try and light the castle again, I guess.
Right.
6:30 there's a bonfire, 7's the flare parade, and 8's the fireworks.
Okay, sounds like, but
giving us
you
the
ought to be down there for the polar bear swimming. I cannot imagine the shock that happens to people when they jump into 32-degree water,
Yeah. I won't be participating
I
in
will
that,
not.
but maybe I'll watch it, but I won't be participating.
I will not torment my heart by doing things like this. Okay, thank you. Thank you very much for the information. It sounds like it's going to be a gala occasion down there. Let's meditate on the beauty of life up here in Chautauqua County, and the Ice Castle is part of it. The visiting nurses are part of it. We've got some wonderful things here, and not to mention the beauty of the hills and the mountains and the streams and the beautiful forests and the leas and meadows. What a place to live, and there is ice fishing too. Oh, I've got a break for you. Remember, you're number one in the whole universe, so give yourself a moment of silence and quiet and peace every day. This is for you.